If you've ever needed a specialist in medicine, there are plenty out there, from orthopedic surgeons to neurologists to ophthalmologists. But we found here in the Treasure Valley Dr. Rob Hilvers, who really has a niche in medicine. So I'm so thankful to have you on the set today.
Thank you for having me.
Carving time out of your schedule. You know, my first question is always, did you always know you wanted to be a doctor?
No,
You didn't?
Nope. I grew up here in Eagle, and I went to college in New York, and I really thought about going into aerospace, thought about working for NASA. I thought about music. I wanted to play ball, and during college, I had an injury playing ball in college, and I had surgery, and it was somewhat a traumatic experience, and I became friends with my orthopedic surgeon, who...
You always want to be friends with your orthopedic surgeon.
Who kept convincing me to think about going into medicine. So finally, my junior summer, I worked with him in the hospital, and I loved it. And so I kind of made a last-minute decision to go into medicine. So it was really great at that point in my life to make that decision based on reasons that were really true to the heart.
Right, instead of this is what I think I want to be.
Yes.
You know, I know too, early on in your career, you traveled internationally, so you climbed mountains, you have done...
I've been very fortunate to have some experience.
But you did medicine too while you were there, so tell me a little bit about that, because I think this gives you the background on what you've set up today, so I want to hear about that.
You know, at some point when you finish medical school, you have to make a decision, what do you want to do, what do you want to be when you grow up? You know, so I struggled, do I want to go into orthopedics, do I want to do pediatrics, and I really wanted to be able to do international medicine, and so family medicine was really that avenue. So I did my family medicine, I did a sports medicine fellowship afterwards, but it allowed me the ability to travel. So when I was a resident, I worked for the Himalayan Rescue Association Clinic for 6 weeks, and so I spent 6 weeks in Nepal on kind of the Everest Valley, practicing medicine and search and rescue, and then I spent a month on Mount McKinley with a group of Idaho climbers doing a fundraiser for Make-A-Wish, which was wonderful. And then I was really fortunate when I finished all my training to spend 3 months on an icebreaker in the Antarctic. So, and was wonderful experience.
3 months.
3 months. Yeah.
Wow. So I mean, I think this has built into something. But what I see, as I'm watching your little path and journey here, you went from that point to this niche in developing a clinic for first responders. I mean, how did that jump happen?
So in 2004, I first got introduced to Deputy Chief Tracy Rayner, who was the chief at the time for the Special Operations Team. And originally we were asked to take care of 30 members of the Boise Fire Dive Team, which was wonderful. So we put together a makeshift clinic and put up curtains, and we borrowed an EKG machine, and
kind of MASH.
Yeah, exactly. It was the greatest group of individuals. I had a blast, and I got to start to train with the guys a little bit. I got turnouts. I went through part of a recruit class.
So you did the training with them.
I did as much as I could. So I got to do a couple live burns, training burns, and so you get a sense of really what these guys go through. You wear your turnouts, you're crawling around, in a fire situation, and you realize how hard their job is, and how important it is to be in shape and to have good shoulders and a back and knees and.
They can't worry about their body because they really have to keep their head.
I have an incredibly challenging job, yes. And so then year 2, I said, hey, would you also take care of our hazardous materials team? So
then you're working with hazmat.
With hazmat.
Wow.
And then eventually the next year was the high angle rescue team, and then it just kept, every year I got a call from 1 or 2 more departments about being more involved. And I think quickly what I realized is a background in family medicine, sports medicine, and particularly with a background in emergency medicine was really the ideal recipe to take care of these individuals.
That's what I was going to ask, is what sets you apart, because I do think you're international, being in a culture that's different too, because this is a different culture. These guys are warriors. They're a different culture than your average bear as well. So I think what qualifies you, what sets you apart differently, all that background.
I think it's just a lifetime of cumulative experience. I think it's all helped. When you look out there nationally of who takes care of fire, and in some cases police, it's often occupational health, and I think they do a good job. I think their focus is though annual wellness exams and injuries, where I think our focus is that, but from a family medicine perspective. So we get to know these guys. So these guys have been patients of mine for 10 or 12 years. So we manage the blood pressure and the hypertension and the injuries. And because I think there's this really confidential, trusting relationship, they are comfortable coming to us with behavioral health issues. These guys are human. So these guys go through stress and trauma and divorce, and their jobs are incredibly traumatic. So these guys see stuff every day that would blow the average individual away. And so that cumulative stress and trauma, there's a behavioral health component of that.
And it wears and tears your body. And I know that was one of the components that we were talking about, was the cardiac health of these guys, which I had no idea. So tell me a little bit more about that, because we didn't get to.
So if you look at like New England Journal of Medicine published an article in 2007 that documented that the on-duty cardiac death rate of firefighters is 44%. So 44% of guys who die on duty are going to die from a cardiac event, which to me seemed incredibly high.
Wow.
I would think injuries and structural issues and inhalations, but cardiac disease. So when you compare that to law enforcement, it was 22%. When you compare that to average workers, it's somewhere in the 10 to 15%
Wow.
range. So,
Okay.
so why such a high risk? And well, when you look at their unique risk factors of the intense 3 a.m. alarm, that fight, flight, that blood pressure, the heart rate up.
Wake up, yeah.
There were in these turnouts. So there's a great study in Orange County fire, and they said, hey, if you take a firefighter and you have them do severe exertion for 30 minutes, the average core temperature is 102.5. So now you throw hypothermia in that mix, and then the exertion in it, and then you throw inhalational exposures, right? There's carbon monoxide, there's cyanides, there's all these different particulate matters competing for oxygen, and then of course pride. These guys are not going to stop with chest pain. They're very dedicated. They love their job, but they're
passionate about what they're
passionate
doing.
about what they're going to do. So you have to realize we have to do everything we can to try to screen and prevent cardiac disease before it's an issue. So one of the things that we've, St. Alphonsus had started with Dr. Steve Ryder and Dr. Penny Snybert, had started a cardiac study looking at if you do a CT coronary calcium score, you can measure is there early cardiac disease or mature calcified plaque in the heart. And so we've started that study with Boise Fire and Police if you're over age 35. And as part of that, and then we're following people over 4 to 5 years saying, hey, based on that information, the feedback you get, can we change lifestyle over 3 to 4 years?
So you're doing preventative.
And can we show a change of the rate of that the disease?
Right.
Well, one of our law enforcement officers came in, and I had never met him before. Super guy, 39 years old, probably one of the nicest law enforcement guys you'd be, and came in for his initial exam, had no risk factors, had denied any chest pain, had no family history of disease. So during our process, we did our EKG, which was normal, and we put him on the treadmill. We do this kind of intense cardiac stress testing, and we push him hard. And he had a very abnormal stress test. And so I was looking at the individual and looking at his stress test. And I'm like, any symptoms? He's like, no, I don't have any chest pain. But he was grabbing his left shoulder. I was like, he's like, yeah, every once in a while when I do a really severe CrossFit workout or something, I get some scapular shoulder pain.
Right.
So I looked at him. I said, you know what? I'm uncomfortable. Let's at least have you see cardiology once and make sure this is your baseline and is it a false positive or not. So that was a Thursday I saw him. So Tuesday morning he saw Dr. Steve Ryder, and I got a call within 2 hours. Dr. Ryder said, markedly abnormal stress. He did a stress echo where they do an ultrasound of your heart and really had very poor left ventricular wall motion, suggesting there's a significant blockage. So he did a catheterization, a cardiac catheterization, and found he had a 90+% blockage. So a severe blockage of his main coronary artery. So that was
with no symptoms except
he denied ever having chest pain.
Wow.
And no risk factors. And so that was on a Tuesday morning. So Thursday morning he got open heart surgery, had a 2-vessel coronary bypass. So this individual, so this was 2 years ago, this individual, you can imagine the stress in the rehab after open heart surgery. So he went through several months through the rehab, and he's doing fantastic. He's been back active duty, went back about 6 months, and he's doing great. But it was, I don't think what he recognizes the impact on me, because I struggled, do we send this guy or not?
Right.
And when Dr. Ryder had called me, and I talk about your heart dropping and getting a little nauseous, like, wow, there's a chance we may have not sent him.
Right.
So I felt very fortunate we did.
Yeah, the responsibility on you as a doctor, and these guys maintain symptom-free attitudes because they don't want to be broke. They don't want to be broke, and they don't want
to have any risk of losing their job.
Right.
And
so
nor do we. I want to do everything I can to keep these guys healthy, and I think the way to keep these guys healthy is to pick up those early cases and intervene and keep them healthy.
So you guys, you're not just in this brick and mortar place here, though, right? You are traveling all over Idaho, so you're doing this MASH unit thing. I like to call it MASH unit. Sorry, but so tell me a little bit about that.
So we got called from Pocatello Fire about 4 years ago, asking if we'd be willing to do annual wellness exams on their members. And so wasn't sure it would make sense, but we did it year one to see, and it's gone great. So we've been to Pocatello for 4 years now. We last year started seeing all the commissioned officers for Idaho State Police. So we traveled to Coeur d'Alene, northern Idaho, and to eastern Idaho to see their individuals. We've been contacted by Coeur d'Alene Fire. We've been traveling a little
everywhere.
bit, so it's wonderful.
That's fantastic. I think really one of the questions that I always want to know, because I know you worked in the ER, and there's the show ER. What is a great lesson you learned in the ER?
Yeah. So I've worked in the emergency room. I'm very fortunate to. We have 2 great hospital systems in this valley, but I've been very fortunate to be in St. Luke's and with Emergency Medicine of Idaho. I was being a patient. I had 4 years ago. I had a.
You were a patient in the ER, so not as a doctor. Your lessons as a patient. Okay.
I had a severe bike accident. I was hit the pavement at 30 miles an hour. It was my fault. I went down. Both tires went out, and had a severe femur fracture. I broke it in six major fractures, and I remember laying on the pavement, recognizing what happened, and it's humbling to be in that patient role. And I remember
for a doctor to be the patient, so.
From the paramedics coming out to, I knew the fire guys, and they're like, "Doc, that's our doc," So they put an IV in, they were trying to help me out with something for pain, so they could even get my leg to the point they could get me on an ambulance. And then I got wheeled into the emergency room, and Dr. Amy Brook, who's one of my dear friends, was my treating physician, and it was great to see her. But it was so I in the emergency room for several hours, got worked up, and then I spent that night in the emergency in the operating room, and I had almost 7 hours of surgery, and I had plate and 13 screws, and I woke up the next morning, dropped 60% of my blood overnight. So I spent the next 8 days in the hospital, and I spent almost a month on a walker, and then I spent another 4.5 months on crutches, and I spent almost 2 years on a cane. But it was a very humbling.
Right. I was going to say, for a guy like you who's very active and doesn't like to slow down, that's humbling. But it had to give you some new perspective on disability alone.
I have much better appreciation for chronic pain. I have much better appreciation for disability and the fear of losing your job. I was fortunate that my ER group in St. Luke's allowed me to go back in the emergency room at 5 months later, on a cane, knowing I would be the slow guy. Right. They were very gracious to me, but
they probably appreciated you being slow.
So it's absolutely changed everything I do when I look at medicine.
Kind of
I look at patients.
Formed you as a doctor. So I know you are consistently expanding. I mean, your clinic is amazing, but you're looking for more staff. And how can people reach out to you if they have questions, they want to get more involved, or they want to fill some of those roles that you're trying to fill?
So probably the easiest way is we have a website, www.er-hc.org, emergencyresponders-he.org. You're right, we're always looking for, we're growing, we're always looking for more staff. We are I'm actually looking for a really well-experienced medical assistant. So if somebody out there has got great experience in family medicine, we're looking. At some point, we're also really looking for a great clinic manager.
Okay, good to know.
Thank you.
And thank you for all you're doing for our first responders. I mean, I really think you're doing such a great service for these guys that need somebody that they can go to and trust.
I have the best physician job in town. I love what I do. These guys are wonderful.
Yeah, thank you.